Hi, my name is Callie Hayes and I'm an occupational therapist at the University of Utah Burn Center. In this video, I'm going to be showing some quick tips and tricks of how to stretch a hand, thumb, and or wrist after sustaining a burn injury. Today my model has this kind of dressing on. You or your loved one may have a different kind of dressing in place, but the same rules and principles of stretching still apply. General rules when it comes to stretching burned skin is that a long stretch is more important than a lot of repetitions. For example, it might take 2 to 3 repetitions to get an adequate stretch rather than 8 to 10. But each stretch should be held for at least 20 to 30 seconds in order to give the skin enough time to stretch. I'm going to start talking out with the palm, okay? If you or your loved one has sustained a burn injury to your palm, the primary stretch is allowing for full extension of the palm and the fingers. What that looks like is essentially holding the fingers, pulling them out to stretch, and pulling them back as far as the patient can tolerate. And once the patient is able to get to that end point, hold it, and then on the next rep, try to go a little farther. With this, you also want to bear in mind the thumb, that you are pulling the thumb out to allow full stretch of the entire palm, something along these lines. And again, holding that stretch for 20 to 30 seconds. Children's hands are more mobile than adults, so they might be able to bend their fingers back quite a bit further than an adult can. Things might crack, tear, or bleed a little bit. If this is a new burn, that is all okay. Proceed with your stretching because you will only heal as far as you are moving. That may not necessarily be the case if you are a newer graft, in which case you may need to be a little more gentle so that we are not causing any new injury to the graft. Let's move on and talk about how to stretch your fingers in the other direction. More commonly, we see burns on the top of the hands and the top of the fingers. And what can happen is if we are not adequately stretching, over time, that skin will want to pull the fingers back into this kind of claw formation. We don't want that to happen, so it is important that we are stretching to avoid this. How this might look is that you or your loved one will start by doing each finger individually and then progress to doing them all at one time. For this video, I'm going to start with the pinky. What you want to do is essentially use your index or middle finger to support in the palm of the hand, while using your thumb to apply pressure between the 2 knuckles on that finger. We have 3 knuckles in the hand. You have your big knuckles, you have your middle knuckles, and your small end knuckles. Where I'm applying pressure is right between that big knuckle and that middle knuckle. And what I'm doing is essentially pulling that finger down while leaving the rest of the fingers straight. So again, that would look something like this when you are doing it to someone else. They may not get quite this far right out the gate depending on how swollen someone is or how bulky your dressing is. Again, you go to the point that they feel the stretch and then you hold it there and do a couple more repetitions, each time trying to add more and more and more. So again, how else you can do this is using your thumb to support in the palm and using 2 fingers to apply that pressure, much like this. And again, I'm not applying pressure to the end of the finger or even to those middle knuckles. It's right in the middle, while I'm using my thumb to support the joint in the palm. And you would go so on and so forth to each finger to where it looks something like a tabletop. Okay? Now, the next 2 stretches I'm going to show you, you should only be performing if your therapist tells you to. If you have not been instructed to perform these stretches, it is not safe for you to be doing these at home, as you can cause further damage to the tendons in your fingers. So that being said, I will show you these exercises, but please do not perform these unless your therapist has specifically told you to do this. So our next stretch is essentially to get those middle knuckles and your end knuckles stretched, okay? Much like before, except this time I'm supporting the big knuckle in the palm. And then what I will do is I will gently curl the finger like so. So when I'm helping someone else, how that might look is I use my other hand to support the big knuckle, and then I use my other hand to gently curl the finger. Depending on where your burn injury is, I have found that the least painful way to do this is to apply that pressure directly on the fingernail. If someone can tolerate you applying pressure somewhere else, that's okay. But this is a stretch where you don't want to be overly aggressive. You just stretch to the point that they tolerate, you hold it and let it go. This especially applies to new burns. And again, I go down and I do each finger individually, holding them each for 20 to 30 seconds. And then I would do them all. I like to take my whole hand and use that to help me curl the digits, as you can see here. I'm not allowing those big knuckles to bend. I'm just applying that pressure at the end. Okay. And then opening the fingers back up. The next stretch in this sequence, again, take precaution. Only perform this exercise if your therapist has told you to. The next one is where we are reaching down towards the base of the hand. No longer curling the very end knuckles, just the big ones and the middle ones. So it would almost looks like a fist. So I like to have patients try to do this one on their own as much as possible, but you can add that little extra help like so. And again, holding it for 20 to 30 seconds. Okay. And last but not least would be someone performing a full fist. Again, only perform this if your therapist has told you to. If we have instructed you not to do these, please do not do this because you can cause too much stretching over those tendons in your fingers, and that can become more problematic. So again, here you can do each finger individually and then as a whole, rolling it into a fist and holding it. You can also perform these exercises on your own with a family or loved one just kind of helping you through it. So I can say, Kenna, please go ahead and move your fingers into this position. And then we're going to progress to this claw position. Next, I'm going to have you go down to the base of your hand. And next, I want you to go ahead and make a fist. Okay? That is how you are going to stretch the fingers, whether you are doing it actively on your own or if you were having a loved one help you. You can also do this to yourself using your other hand, but it can be oftentimes hard to perform this on your own if you're in a lot of pain. Next, let's talk about the thumb. When it comes to the thumb, we talked about how stretching it if you have a burn on your palm this direction. But the other thing you want to keep in mind is if you have a burn on the top of your hand that is crossing this web space, that we are providing an adequate stretch to this web space. How that might look is helping your family or loved one pull that stretch into an L shape. Again, holding for 20 to 30 seconds, okay? If your therapist has instructed you to, a way that you can perform this on your own is doing what we call a diamond stretch, where you place your index finger and thumb together and apply that pressure to spread that web space into a stretch. Okay. Next is going to be pulling that thumb across the palm like you're making a number 4. You assist down here at the base of the thumb for this stretch, pulling it across like so. Notice how I am not putting any pressure on the end of the thumb or on that thumb knuckle. It's at the base of the thumb. Next, to isolate to stretch this thumb knuckle, you brace the base of the thumb and apply pressure on the tip of the thumb to bend the knuckle like so. Much like you stretch the little knuckles on the fingers. I can also ask the patient to go ahead and do that on their own, where they're pulling the thumb across and adding the little knuckle to that stretch. Last but not least, when it comes to the fingers, we want to work on opposition. So that means touching each finger to your thumb. And it is often hardest for the thumb to reach the pinky, but keep working at it. An important note is sometimes people will do this, where they're touching almost like to the middle of the finger. You need to be working on touching towards the tip. Let's talk a little bit about stretching the wrist, because oftentimes if you've burned your hand, you've also burned your wrist. So if the burn crosses this bottom side of your arm and wrist, essentially you want to stretch it this direction. How that might look, if you were helping a family or loved one, is that you're supporting their forearm, placing your hand in their palm, and pulling the wrist back. What you don't want to necessarily do is pull on the fingers to do this. Sometimes that means you're not necessarily getting an adequate stretch, and this can be more painful for patients. Sometimes what I see happen is people will do this rather than actually stretching at the wrist. Again, holding for 20 to 30 seconds. You will also want to stretch the wrist into a flexed position. So again, I'm applying pressure on the top of the hand, not on the fingers, to pull the wrist into flexion. Again, what I don't want to happen is that you're doing this. If you're trying to stretch the wrist, you want to apply pressure on the top of the hand and pull it into flexion. Okay. Patients can also do this on their own, going back and forth and taking their other hand to help. Another great way to stretch the wrist is what we call a prayer stretch and a reverse prayer stretch. How this works is you place your hands together. While keeping your palms together, you bring your elbows out to the side, and you hold that stretch for as long as possible. You can use your non-burn side to help apply pressure to the burn side for an added stretch, or in both directions if both sides are involved. The reverse prayer stretch is essentially the opposite. You are placing the tops of your hands together and pulling your elbows down. It's not fingers together and pulling down, top of your hand and pulling down onto the wrist. Again, 20 to 30 seconds. Your wrist also moves side to side, so stretching it this way. But we also sometimes do what we call a fisherman stretch, which looks something like this. Whether your thumb is pulled or not depends on your readiness to tolerate that stretch. Again, your therapist will instruct you if you should be performing this stretch or not. So I'm gonna help support Kenna. Her wrist here, I'm pulling on her hand into this sideways direction. I can also have her pull her thumb across as well. So we're getting that, what we call a fisherman stretch. When it comes to the wrist, we also do wrist circles. I typically recommend doing about 10 circles in each direction. And when you're doing this, you're not doing fingers, and you're not moving from the elbow. You might have to support your forearm and isolate just at the wrist in both directions. It is pretty common that people are most stiff when they wake up right away in the morning, and it might take a little longer to stretch in the morning so that things loosen up a bit. With a burn, that skin is constantly tightening, and so doing your stretches once a day will not help you in the long run. You need to be performing these stretches and exercises multiple times throughout the day, a minimum of 3 to 4 times. You can certainly do more. You will not overdo it, and the more you do, the better outcome you will have in the end. The really big precautions here were the ones I mentioned earlier when it comes to these middle and distal knuckles. And again, your therapist will instruct you on what exercises you need to be performing and which ones to avoid. You should be getting written exercise programs as well on how to follow these. Your therapist might also give you some form of a squeeze ball or foam to work on grip strengthening, as well as maybe what we call a hand helper with the rubber bands. Again, they will instruct you on what you should be doing and how to do it if that is indicated for your situation. Again, if you have any therapy related questions to stretching or strengthening, please give us a call. Our office phone number is 801-581-2132, and you can talk to any of our burn therapists there with any questions. Thanks.